crazy. We should have started by now.
Sorry, I missed the bus.
Whoa, hold up. You definitely want to let him rest for a bit. Welcome back to another practical lab skills video, where today we're going to be looking at how to use an aneroid sphygmomanometer, or more commonly known as a blood pressure cuff. So we'll start off by going over the practical demonstration, and then at the end I'll go over a few of the more frequently asked questions about blood pressure. We're joined by Arthur, who's going to be our participant today. Now, before you try to take any kind of reading from your participant, it's important that you allow them to rest for at least 5 minutes. Now, Arthur's actually been sitting here for a while, so we're okay to just crack on. The first thing you want to do is you want to ask your participant to remove any bulky or restrictive items from their upper body so that you have good access to their arm. Now, one thing to consider is that if they do have an item of clothing that they can kind of roll up, you can get away with just doing that. But the rule that you want to look for is that they can comfortably fit 2 fingers underneath. And if they can't, then it's always best that they take it off, or at least kind of take their arm out of the sleeve. So Arthur, if I could just get you to take off your hoodie, that would be great. Well, the next thing you want to do is you need to identify the brachial artery. Now, to do this, if you get your participant to just straighten out their arm, and you want to get them to just bend it ever so slightly, and you're just feeling for the bicep tendon in the middle of the antecubital fossa. Antecubital just means the front of the forearm, and fossa just means depression. So once you've found that bicep tendon, you can just get them to straighten their arm again, and you then just want to move your fingers about 2 to 3 centimeters medially and press down firmly, and then you should be able to feel their brachial pulse, which you can feel as it's very strong. Now, once we've found that, that's where we're going to be placing the head of the stethoscope when we take our blood pressure reading. So the next thing we want to do is we want to attach the blood pressure cuff to the upper arm of your participant. So you just want to get the participant to lift up their arm. You just want to slide it on up. Now, if you have a blood pressure cuff that has an integrated stethoscope, it's important that you get the head of the stethoscope right on that site that we've just identified on the top of the brachial artery. But you also want to be careful for the cuff not to be crossing over the elbow, as that can be quite painful when you're inflating the cuff. So we just want to place that one into place, and then we just want to wrap around the cuff and just secure it into place. You don't have to go super tight, because it's going to get tight once you start pumping it up. This is just so it doesn't slip when we're taking our reading. Your participant's arm should be resting on a table at heart height. If you need to, you can pop a pillow underneath their arm to achieve this. The next thing we need to do is to pop the earpieces from the stethoscope into our ears, and we're going to take the bulb of the blood pressure cuff in our right hand. Now, it's best to do this in your right hand, because if you have a blood pressure cuff that doesn't have the stethoscope built into the cuff itself, you'll need your left hand to hold the head of the stethoscope on the brachial artery. So from a very early days, you want to get in the habit of always having your left hand free in case you need to do that, and do everything with your right hand, and we'll show you in detail how to do the cuff just with your right hand. So we want to pop the earpieces into our ears. To help you to clearly hear through the stethoscope, you may also want to angle the earpieces so the sound is directed into your ear canal. Now, I'm very aware that I don't have both of the earpieces in, but I had to keep one out so I could hear myself talking to allow myself to explain things properly to you. So forgive me, but remember, make sure you put both in your ears when you're actually doing it yourself. So with the bulb of the stethoscope in the right hand, you then want to turn this little screw on the left-hand side towards you, which will close it and make it ready to start inflating. Now, when you close this, you just want to turn it until it comes to a stop. Don't force it closed, because when you then have to open it later, all the air will rush out too quickly and you'll just have to start again. So when you're closing it, just gently turn it until it comes to a stop. That is enough. So you then want to start squeezing on the bulb and inflate until you get to 160 millimeters of mercury. Now, this is enough for most healthy volunteers while they're at rest. However, in clinical populations, you may need to go much higher than this, but for Arthur, this should just be fine. Now, while listening through the stethoscope, you just want to turn the little screw ever so slightly away from you to start letting the air out of the blood pressure cuff. And when you first start to hear the pulse sounds, you want to make a mental note of where the needle is pointing on the dial, and that is your systolic blood pressure. You then want to continue slowly letting out the air at a rate of about 2 to 3 millimeters of mercury per second, and keep releasing until the last time you clearly hear the blood pressure sounds. The last time you hear the pulse sounds, that is your diastolic blood pressure. Make a mental note again, and then release all the remaining air out of the cuff so that it relieves the pressure on your participant's arm. So once you have both of your results, you can then relay that to your participant and remove the cuff from their arm. For anyone following along in real time, I'll put the reference ranges up on the screen now. You may have noticed that the pulse sounds can change throughout the time that you're taking a blood pressure reading. Now, the different sounds that you can hear during blood pressure reading are known as the Korotkoff sounds and follow a usual typical pattern. When you first start to hear the pulse sounds, it will come in a sharp tapping sound. Then, as you continue to release air from the blood pressure cuff, it will transition into a more soft swishing sound. The sound will then become much louder and very crisp sounding before transitioning into a more muffled blowing sound and then completely fading out. Another thing to note is the units that blood pressure is measured in, which are millimeters of mercury. Now, these units come from this more old-fashioned blood pressure machine, which actually has mercury contained within it, and when you increase the pressure within the blood pressure cuff, it pushes the mercury up the scale, which is then measured in millimeters. And that's where the units of measurement, millimeters of mercury, originate from. Now we've completed all the practical demonstration, let's go over a few of the more frequently asked questions about blood pressure readings. Now, the first question we have here is, what exactly is blood pressure measuring? Well, blood pressure is a measurement of strain upon the vascular system at two different times. Now, your systolic reading is the amount of pressure that's within your arteries while your heart's contracting and it's pushing the blood around the body. The second number, the diastolic number, is the amount of pressure that is left within your arteries while your heart is relaxed and it's just refilling with blood. How the hell do you pronounce Sphygmomanometer? Well, I'll write it on the screen here phonetically to try and help you to learn it, but realistically, everybody just calls it a blood pressure cuff, so don't worry about it too much. How does the blood pressure cuff work? Well, when you attach the blood pressure cuff to a participant's arm and you inflate it, it stops the blood flow getting to their forearm. Now, as you start to release the pressure in the blood pressure cuff, it will reach a point where the pressure in the cuff is less than that of the pressure within the arteries, and it will start to return the blood into the forearm. And this is your first reading, your systolic reading. As you continue to let out the pressure from the cuff, you will then kind of get to a point until the pressure within the cuff is equal to the amount of pressure within the arteries, and that is the last time you hear the blood pressure sounds, which is also the diastolic pressure. Why don't you just use an automatic blood pressure machine? And it's a good question. Now, straight out of the box, automatic blood pressure machines are very accurate. Often is accurate within about 3 to 5 millimeters of mercury of a more manual kind of method of blood pressure. But over time, they will start to drift and lose their accuracy and do need recalibrated, but people rarely do this, and as a result, the automatic ones are a little bit less accurate than the manual method. And that's it. Now you have all the skills you need to master taking a manual blood pressure reading from your participant. If you haven't already, make sure you check out my other videos in the Apply Practical Skills playlist, which you can click on here, and I'll see you in the next one.